For over 30 years, Unity Hospice and Palliative Care has been committed to delivering exceptional care for our patients and support for their loved ones. We understand that for some people, the idea of hospice can seem overwhelming. Some even think hospice speeds up the dying process, but that is simply not true. Hospice provides medical care for pain and symptom management, as well as emotional and spiritual support for both the patient and their loved ones. Hi, I'm Becky with Unity Hospice and Palliative Care. Whether you're new to hospice or have just started care, I'm here to help you understand what to expect when you join hospice. In this video, we'll discuss the informational meeting, your initial assessment, who your care team will be, and how often they'll visit. The first step in hospice care is an informational meeting with a hospice care coordinator. In this meeting, the care coordinator will learn about the patient and identify goals of care. They will also provide an overview of what to expect from hospice. Your next visit is the initial assessment. During this assessment, we will go over several things, including eligibility requirements, your care plan, and medication, medical equipment, and supplies. First, eligibility requirements. Hospice is for people facing a serious illness with a prognosis of 6 months or less. A hospice nurse will evaluate the patient to make sure they meet the requirements for hospice care. Next, the care plan. Once the hospice nurse and the patient's doctor confirm eligibility, the nurse will work with the patient and family to create a personalized care plan that meets the patient's needs, values, and priorities. Lastly, medication, medical equipment, and supplies. We will order medications, equipment, and supplies to keep the patient comfortable. This can include a hospital bed, anxiety medication, an oxygen machine, pain relievers, and other items. After your medical needs are addressed, you will be assigned a care team. The care team includes a registered nurse, a doctor, a social worker, a certified nursing assistant, and a chaplain. Hospice nurses ensure pain and symptoms are managed and the patient is comfortable. They also educate the family about their role in care. The doctors oversee the care plan based on the nurse's evaluation visits. Social workers support the emotional needs of both the patient and their loved ones, and also help connect them to community resources. CNAs will occasionally help with hygiene care and also educate caregivers on daily upkeep. Hospice chaplains are non-denominational and offer support by honoring individual needs. It's important to note that hospice care does not mean 24/7 nursing at home. The goal is to keep the patient comfortable and support the family. A nurse will visit periodically, adjusting the frequency based on the patient's needs. The rest of the care team, which includes your social worker, chaplain, and nursing assistant, provides additional support for the family and patient. Like the nurse, they will visit periodically with the frequency based on needs. Hospice team members are available 24/7 for any urgent needs or crises. When the time comes, we offer bereavement support to help the patient's family during their grief. This support is available for 1 year after a loved one's passing. Now that you know what to expect, we hope you feel at peace, knowing that hospice aims to improve the quality of life for patients by providing physical, emotional, and spiritual support. To learn more, please contact us at 1-888-61-UNITY or visit unityhospice.com.